So we will have this recorded for you. This is the first of 2 Kahoots that I'm going to do as an exam review. You'll see some newer questions and you'll see some ones that the questions have been changed a little bit and some exact questions. But I think all in all, you're going to get all the concepts you need for your HESI. It was my Thursday class who begged me for a new Kahoots, and that's why I made one starting Friday. Got it done. All right, we're just going to go get started because basically we just want to go over questions. We want to listen to what I have to say about them. So happy St. Patty's Day, everybody. HESI Review 2022. What is probably the single most important influence on growth at all stages of development? I think you've heard this at least 100 times from me. At least. Nutrition affects everything, cognition, motor delays, fine. It doesn't matter, it affects everything. Frequent developmental assessments are important for which reason? We know that when you have a child and we're doing these developmental assessments, we can find out if their gross motor, fine motors are delayed just by what those assessments are and how old they should be. You know, an 8-month-old, are they sitting up unsupported? That's what we should see. If we're seeing those things, we're okay. But if we're sitting in one place, something's wrong. They should be moving forward just a little bit. The head to tail direction of growth is referred to as head to tail. And it's called cephalocaudal, okay? Head, cephalo, what your cephalic is your head. Caudal is down to your butt. It's how you move and how you start moving around, lifting head up and turning over, etc. What is the single most important factor to consider when communicating with children? We know that children are not going to understand a word you say if you talk over their heads. Get on their level. Let them know that you're talking to them in their words, and they'll listen, and then they're going to understand and get procedures done that normally you wouldn't be able to. What 2-year-old child pain assessment tool should the nurse use? You have a 2-year-old. What is that pain assessment tool? You know, and these are all according to ages when you should start to use them. And we should use FLAC, and this is the most common mistake. That's why this question is here. FACES doesn't start till preschooler. So FACES ages 3 and 4 and 5, and then numeric, they say the book is age 8. FLAC is those younger. It doesn't mean a 2-year-old can't point to FACES, but we want to really evaluate the pain well. So FLAC is the best one. What is priority treatment for a child with dehydration due to profuse vomiting? Your kid is puking everywhere. What are you going to do? So IV fluids, if you're vomiting, nothing can go in. You know, NPO, not necessarily. You're going to get IV fluids in. Give something for the nausea, vomiting, like the Zofran, the Dononstron, okay? We'll give that. Wait a little bit and start sips of fluids, but our biggest priority to prevent dehydration, which is so serious in children, is IV fluids. The first expected fine motor developmental milestone for an infant begins with which one? Fine motors, F, fingers, remember that. Remember gross motors, get up and go. That means movement. It's the head up, turning and flipping and crawling and walking. So we start out with a reflex, okay? Voluntary means you just go ahead and grab it. Well, an infant starts with, put your finger in, they close it, and they go, oh, they're holding my finger. Well, it's a reflex, but you can believe that they're holding your finger. An 8-month-old infant should be expected to perform which fine motor skill? Motor. What can they do? Fine motor skills. We should be able to grasp that handle, no problem, and use like a crude pincer, which means grab a handful, you know, fingers full of Cheerios and put it in. I think that's the first way we use that fine motor, is when we put those Cheerios or those cheese puffs or whatever those things are now. My grandson loved those things when he was an infant. Then he ate them. In general, an infant should triple their birth weight about at what months of age? These are questions you've seen, you know, before, and you're going to see them again. I've seen this question asked on the NCLEX before. That's why it's here and showing it to you again. 12 months old, triple. At 6 months, should double. Good. An RN assessing a 2.5-year-old toddler should report which finding to the provider? What assessment isn't right? If you're reporting it, something's not right. We know somewhere about age 2, the chest and the head should equal each other and the chest should exceed it. The head shouldn't be that big anymore. We know at birth it's huge, and then the chest builds up to it. If it's still bigger than the chest, now we have to look out for why. Is it hydrocephalus? Is there something going on in that head we need to know about? A 2-month-old has cradle cap. What should the nurse tell the parents to do to treat it? And we're just going to either wash it, mineral oil, just very softly, a comb, a brush it out, and slowly it will go away. Nothing vigorous. Please use soap and water. And, you know, you do need to do something to get it to go away. According to Kohlberg's pre-conventional level of moral development, a preschooler has moral reasoning, understands what? Kohlberg, what does he talk about? Kohlberg talks about right and wrong, and either right has a consequence and wrong has a consequence. Yes, that is Kohlberg. Very good. Which nursing action is appropriate to teach a preschool-age child about a scheduled procedure? You have the child who needs to go in to get, let's say, an exam for, you know, the urine. Well, we're going to give them a doll and we're going to explain and we're going to show them equipment and let them touch it and feel it. And when they go to that procedure, it's going to be a walk in the park. If not, the child's going to be very upset, screaming, and they're just anxious. I would be too if I didn't know. Before performing a physical on a toddler, the nurse should do what to encourage cooperation? Always let them touch and feel the stuff. I mean, child life today has really turned the corner. About the last 10 years they've been around. And those coming in, they teach children how to play with the equipment. So it's now not the scary thing. And, you know, it's amazing that these professionals are trained in child development and they are trained to play with children. It's a great job. Only problem, it doesn't pay that well, to tell you the truth. In terms of language and cognitive development, a 4-year-old would be expected to do what? So a 4-year-old needs to be able to follow commands. Go put your dirty laundry into the laundry basket, put your shoes by the front door, put your plate in the sink. Those things they should be able to do very easily. Parents are concerned about her 8-month-old child is not developing like her older child. What is normal for 8 months? So I'm hitting you with some of those key developmental things that you are going to see again. You know, whether you're seeing it on this HESI or into your NCLEX, these are questions that you do see. So they should be able to sit alone, unsupported. That's what an 8-month-old should do.
Professor.
Hold on, multi-select.
Okay.
What would alert the nurse to hold the digoxin on an infant she's caring for? You're going to hold digoxin. Why? You know, this is one of those medicines, and your client is so small they can't tell you what's going on. If you have an infant on digoxin vomiting, hold it. I don't care, hold it. Tell the doctor, get your level, be safe. Digoxin level's too high, heart rate's too low, potassium's good, which is great, and the child's vomiting. So yes, we will hold it for that. Yes, you had a question.
Yeah, so your last question, it said like they sit unsupported and they pull themselves to a seating position. So by 6 months old, they basically can be sitting by themselves. So that was kind of like the same question.
By the book, it's 8 months old, they should sit supporting themselves. By 9 months, they should pull up and crawl around the couch or the chair or whatever.
So when you said pull themselves into a seating position, it was kind of more like just pulling themselves up, which is like
right, which is like at 6 months old. They're almost getting there, but they're getting up and they're falling over.
Okay.
They're just getting to the position, and the next step is to sit there unsupported.
Okay, that just would make me really think, like, because I was like, well, those are kind of like similar, so that's why.
Right.
Okay.
Absolutely.
Thank you.
No, thank you. Good question. Always appreciate questions. You know that. A 4-year-old is reluctant to take medicines. What intervention should the nurse take? You need to give a child some Tylenol, some Motrin, his first antibiotic, his steroid, because they have croup. And they're saying they're just no excuses. What do you do? Well, what you need to do is a straightforward, don't take anything for an answer. This is your medicine. Do you want it in a cup or would you like me to put it in a syringe? You're going to take it now. Straightforward. Don't come back. No, you're giving them that ability to say no. The parents usually, I'm not saying all the time, will not be able to give that medicine. And to mix it with food or juice, what if they don't eat all the food or they don't drink all the juice? Did they get the medicine? And they're never, ever, ever should put medicine in the bottle or in food, okay? So straightforward, how would you like to take it? And go in straight like that. And usually when they realize that they don't have a choice, they'll take it. And of course, I always have a sticker in my pocket, and that always does help. Stickers are the miracle workers. My grandson just had a immunization, came home with 5 stickers. He was so thrilled. Which concept reinforces the development of a sense of trust for an infant? Now, like I told you, there are 4 Ericksons on this HESI, or one of those theorists. Please review your theorists, your infants, your school age, your adolescents. Those are things that are there. You know, sense of trust for an infant is they're not going to be worried about what's coming next. I cry, mommy's going to pick me up. If I'm wet, they're going to change me. If I'm hungry, they're going to feed me. If I need to burp, they're going to burp me. They predict what's coming. Their needs are constantly met. The other stuff is not what Erickson talks about. It's because you have made a trust. So that child who doesn't have a sense of trust, you know, won't cry because nobody's going to come anyway. And that's what an infant who's being abused or, you know, not given all what they need is going to look like. They're not going to cry as much, believe it or not. They've given up. An infant is NPO and unable to take breast or bottle for feedings. What is important to remember? We talk about infants, and our thing is all about growth and development, and that sucking is very important. What does the suck do? Suck, bite, chew, like Freud says. It gives them a stress of relief. It's a stress reliever. So offering that pacifier, the non-nutritive sucking is it. Never put anything in their mouth because they can choke, and some should not have anything in their mouth. Like a tracheoesophageal fistula should have nothing in their mouth. When teaching sex education and contraceptive for adolescents, what should the nurse consider? Now, adolescents are going to ask, whether it's school nurse or when we ask parents to step out of the room, sometimes to do a little bit of a history with only the adolescent, they're going to ask you things. What should you remember? Give it to them education, but give them it in written form too, so they can look at it. It's not your opinion. It's not how you feel. It's not to go back to their buddies and learn from them. If you have information, give them only information, not your bias, and give them it in written, oral and written form. That's the way, the proper way it should be done for adolescents. A monthly immunization for RSV is. This is an immunization given for those infants who are immunocompromised, who are premature, who are cardiac, who have CF, or many other things that render them, you know, weaker. We don't want them to have all that extra mucus. It's called Synagis or palivizumab. Okay, perfect. And it's usually those 5 or 6 months during fall to early spring. A 3-year-old is brought into the ER with increased wheezing for 2 days. The child uses an MDI. What information is most important to ask now? 3-year-old has an MDI. Wheezing's getting worse for 2 days. What is the most important information to ask next? And that was, did you use a spacer? Did that child get the medicine? If you're not giving a proper spacer, they're not getting medicine, and therefore the wheezing will get worse. Good job. You listened when I told you before. Good job. An infant with hypoplastic left heart is becoming tachypnic, taking a long time to eat, requires rest. What assessment is priority? What do you think is happening to this child? So hypoplastic left heart syndrome is a cardiac. It's a very severe cyanotic cardiac, but the point is it's cardiac. They're becoming breathing more and taking longer to eat and requiring rest. Think about the lungs filling up in congestive failure at this point. Tachypnea, think about, all right, tachypnea shouldn't be. Why is it? Respiratory, could be fluid going in there. Cardiacs do and can gain fluid. So the lungs, just listening to the lungs is first. When doing an admission on an infant with a low-grade fever and a loose cough, what information is priority for placement? You know, as nurses and charge nurses, you get admission, you have to put them in the right room, which is appropriate for the child and the other child who's already in the room. Most rooms are a 2-bedded room. So I want to know if the immunizations are up to date so that I know I am not exposing another infant to the same thing. So knowing what medications, dosages, and time, sure it is, but does that tell me where to place that child? No. Highest fever, it doesn't tell me where to place the child either. Again, it's the reading of this question that had the answer in it. A multi-select. What is included in the plan of care for a child with cystic fibrosis? When you think about a child with cystic fibrosis, we know the sweat test is what will tell us if they have it, which means sodium in their sweat, which means they're losing salt. Therefore, you want salt in this child's diet. They need high protein for muscle wasting, very important. Their chest is filled with all sorts of secretions, and their small intestines is also not digesting what it should. So high protein diet, aggressive chest PT, and pancreatic enzymes with meals. Within 30 minutes of the meals, they should be taken. And we always remember children grow, get a bigger dose as they get older. Which information is most important when rheumatic fever is suspected? Gee, I have two of the same answers, don't I there? It's, yeah, you're going to worry about pharyngitis. Pharyngitis is the strep. Strep causes rheumatic fever. What is a treatment for rheumatic fever? It's a long-term IV antibiotics, and it will take care of all of the issues if the heart valves have not been damaged yet. Once the heart valves are damaged, they are damaged. They're going to need to be fixed. A multi-select. What are some assessments that an infant would have if they were in acute respiratory distress? What do infants look like? I've always said if I have an infant that they say has a cough and I hear them grunting, I am running immediately back to the trauma room. When they're grunting and nasal flaring, this child is very close to stop breathing. So they need intervention immediately. You'd see big abdominal breathing, not necessarily diaphragmatic respirations, but grunting, nasal flaring are your two big warning signs. Infants. It's less than age 12 months old usually. What is the purpose of giving indomethacin to a neonate with a patent ductus arteriosus? So when we have the PDA open, it's the body's own prostaglandins that holds it open. After birth, that hormone, prostaglandins, stops being secreted. That's why we're going to need to give them prostaglandins, a synthetic form to keep it open if we need that duct. To close it, we give indomethacin, which stops the prostaglandins from being secreted, and the duct closes, and it's a medical type of closure. Of course, if it doesn't work, there's always the surgical closure. What is the greatest risk factor for a newborn receiving a cardiac catheterization? Always you worry about the hemorrhage, hemorrhage. You know, that femoral artery and femoral vein are so big that clot can burst and they could bleed out within minutes. So that's why I check first that dressing, that pressure dressing. A 10-month-old status post VSD repair is receiving the morning meds. Those are the vitals. What med should the nurse question? Blood pressure, 118/70, temp 99, pulse 88, respiratory rate 22. A 10-month-old should have a higher heart rate, therefore hold the digoxin. Very good. Enalapril, Vasotec are actually the same drug, but they just decrease blood pressure. That blood pressure is good. So it is digoxin. While assessing a newborn, you notice decreased femoral pulses bilaterally. What nursing action should be next? What should you look for next? Kid's newborn, you just got the child. Those pulses are very faint, can hardly feel them. What would sort of show you what maybe diagnosis this could be? It's probably coarctation of the aorta, right? Because that occludes blood flow going down to the lower extremities. So the lower extremities would have lower blood pressures because it's decreased blood flow going down there. And the upper one it's about 20 millimeters of mercury, they say, higher than the lower. Very good. How do you get an adolescent to open up about their sexual history? So beautiful. Ask them something. You know, if you hear them listening to music, the sort of music you listen to. Oh, I see you got really cute sneakers. Where did you find them? What are you into? What are you going to be when you grow up? Even stuff like that, but of course, more adult-like. But you can break the ice so easily with an adolescent. They just want you to ask them something, not just their mother. Make them feel important. And they will tell you a lot of stuff. Multi-select. When educating adolescents about risk for HIV and hepatitis, what would you include? So abstinence is always the best, but not necessarily they'll follow that. Condoms are important and hand washing. Very good. What stage of Erickson's would you use for a school-age child? Remember, school-age children liked approval. They like to do things better than anyone else. And when they can't, they feel like they have failed. And the industry is that they can write better, add better, spell better, but that inferiority would be they can't throw a ball, they can't do, play PE. So Erickson, school age, you're going to see these again. A multi-select. Child with hemophilia is fallen down, the knee swollen and painful. The treatment would include what? So hemophilia, what is it? It's a lack of factor either 8, 9, or von Willebrand. And when it starts to swell, we know hemophiliacs is going to be blood. It becomes painful. What do we need to do? We need to elevate it, and we need to put cold packs on it. We need to contain it, and of course, rest it. No exercise, and we don't want to dilate the vessels with a hot pack. Very good. Your child with AL leukemia has had recent lab results with platelet count of 10,000. Nursing action would be what? Acute lymphocytic leukemia. I didn't have enough letters to put it into the question, so I wrote it that way. Platelets of 10,000. Whenever, ever you hear platelets, I don't care the diagnosis, platelets going down below 30,000, it is a bleeding precaution. Platelets aid in clotting. Platelets low, This child is placed adult bleeding precautions, and that's the point of that question. Child starts with a nosebleed for no reason. What action should you do first? So the first thing you do is you apply pressure to the nose with the thumb and the little finger, and you press it for 10 minutes. Putting ice on it does help. We don't put cotton swabs, and putting it back, their head back, all they're going to do is swallow that blood, and now they're going to be vomiting blood. You don't want that. An 8-year-old semi-conscious boy is brought to the ER, blood sugar greater than 600, potassium's high, pH is low. Priority action, what do you do first? So you have a child who is in DKA. They're semi-conscious, their blood sugar is huge. First priority is put an IV, normal saline, get that bolus going. And then we're going to give this child probably a little continuous drip of slow, regular insulin to get that blood sugar down. That will aid in the pH to come back up, and the child with the bolus, you'll see them all of a sudden go from pale, semi-conscious, and all of a sudden they're pink. And now you can smell that Kuzmal, that beautiful, sweet, rotten peach smell that I've told you about. Child's admitted with hypoparathyroidism. What findings would you see that needs to be reported to the healthcare provider? Well, what does hypoparathyroid, parathyroid, what does it work with? What is the hormone? What is it in the body that it's taking care of? And we know hypoparathyroid is not enough calcium. We know that hyper is too much calcium. So if we're seeing a child starting with muscle weakness, it's showing you signs of hypocalcianemia. Not enough calcium, it's going to show that. So we need to tell the healthcare provider, and he's going to order a level and then order a supplement. Makes sense. A child has Kuzmal respirations due to DKA. The increased respiratory rates trying to compensate for what acid-base alteration? What acid-base alteration do you see with DKA? Read the question carefully. So this child has metabolic acidosis. The Kuzmal's respiration is trying to do respiratory alkalosis to compensate for it. But the question asks, why do their increased respiratory rate? What are they compensating for? What acid base? And that's metabolic acidosis. When talking with an adolescent regarding personal health concerns, which is most important? So when you're letting a child talk, you know, these adolescents, you know, they do need to talk to someone. And if you've broken the ice well and they're willing to talk to you, let them tell you how they really feel. Because I wouldn't talk to my mom and dad. And sometimes I wouldn't even talk to my best friends about what I was feeling. So to have somebody who's that third person who I feel comfortable with and safe with, then they can get the information that they do need. What procedure is priority to keep the lungs of a child with cystic fibrosis open? Just physical therapy is the biggest priority, and they do it in all ways, aerosols and those vests. And then of course, there's those deep breathing and coughing and exercises, all of those things involved, but chest physical therapy, keep that clog open. In school age, conflict of industry versus inferiority. What does industry mean? So they're able to do something well, the spelling, the science, the math, whatever, and the inferiority is what they can't do well and they're frustrated with. They want to be good at everything. Contraindication to administering the varicella vaccine to an adolescent, an adult, anybody. Varicella vaccine is a live vaccine, know that one. What don't you do with varicella or live vaccines? You cannot be immunosuppressed, so no steroids, okay? Those are questions you will see on your NCLEX. I've had it come back to me that it has been on there. So just to know that, you know, all those vaccines, understanding when and how they're given. We know Hep B is at, at the hospital, it's the first one. And live vaccines should never be given to that immunosuppressed or a child with corticosteroids. That renders them immunosuppressed. Early detection of hearing impairment is critical. Which one is of primary importance? Remember speech. If you can't hear, you can't speak correctly. Very good. You know, and if we hear a problem, what do? Send them for a hearing evaluation. In helping a child to adapt to a hospitalization experience, the best approach is what? So if we have them on a routine that is like their home, it's the best. And of course, bring in the toys, the blanket, the pajamas, whatever, to keep that all into the same routine. But the first thing is the same routine, dinner at the same time, bedtime as close as possible, bath time, etc. And the child will feel comforted by knowing what's coming next. When assessing vision on a child, the healthcare provider would use the Snellen chart at what distance? Now, what would you do if you had a child who couldn't see multiple things at 20 feet? You know, you're going to go to the next level, right? That means they're not seeing as well. And you're probably going to notify, the physician.
Professor Bogart, I have to go. I gotta take
Go
my
ahead.
kid to practice. Thank you.
Oh, go ahead. Good luck to you. Referrals for cognitive impairment should occur when? Cognitive impairment could be didn't have proper nutrition, had hypothyroid at birth, and now they need some help. When do you do that? Well, infants are so resilient. As soon as you possibly can, just like fractures, as soon as you possibly can, get them into treatment. Speech, physical, occupational therapy are what we need to do for those children, and we can bring them most of the time back to where they should be. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? So again, you are definitely going to be letting them play with the equipment. So important. It's not as threatening. In fact, get your blood pressure taken by them. When nurses discussing sexuality with parents of an adolescent with cognitive impairment, what is important? You have an adolescent with, let's say, a mild Downs who may possibly go live on their own at one point. What's important to discuss? Why do they need to know about sex? You need them to understand what's a good touch, what's a bad touch. You don't want people to taking advantage of these children. Very good. What acid-base imbalance might you see with a child having profuse diarrhea? You know, when you have diarrhea, you have all of those things that the small intestines and those all the enzymes that dissolve food and help it be more usable. And that's all alkalotic type stuff. So you're getting rid of base, alkalotic, okay? So what are you left with? Acid, metabolic acidosis. Now, if you're vomiting, you're getting rid of acid. So it would be metabolic alkalosis, okay? Those are the difference between vomiting and diarrhea. Multi-select. And if an infant has not passed the meconium stool within the first 24 to 36 hours, what would you assess for? So Hirschsprung's, because that's that outpatching where you might have a little ribbon, little type of stool coming out, but usually not even that. Cystic fibrosis and hypothyroidism are both known for no stools. So those three things for sure. Electrolyte balance has nothing to do with stool. A child with sickle cell disease would most likely exhibit what sign? What are they going to be complaining of? What do you see? I mean, what usually brings these children into an emergency room or to the doctor is the pain. But remember, a lot of the pain is due to not enough fluid. So we're going to give fluid for that dehydration. Tachycardia also is due to dehydration. You know, and then once we dilate, give pain medicine. These children, and of course, they're going to usually have an infection with it too, and low hemoglobin hematocrit. So, but the first thing that brings them in is the pain. All the other lining things are the reason for the pain. So we correct it, correct dehydration, you know, correct the blood, etc. Give something for infection, and these children turn around quickly. When teaching a child and family about celiac disease, which one of these food items is allowed? Oh, I've got two of the same thing. I was doing this over the weekend. I was doing it with my grandson here. So I guess he was bothering me then. So wheat, rye, and barley are what you should avoid. They can have rice. A 6-year-old child goes to the ER due to abdominal pain, fever, and vomiting for the last day. What assessment is priority? Child has abdominal pain, fever, and has been vomiting for 24 hours. What assessment is priority? What do you need to know about this child? Where is the pain? You know, is it right lower quadrant? Is it an appendix? Is it something else? So where is the pain? And then you go and you'll do the vital signs, et cetera, looking for dehydration. But you really want to know, where is that pain? What's going on? Is this a surgical emergency? A multi-select. Signs and symptoms of hypertrophic pyloric stenosis. You're going to feel that little olive right underneath your xiphoid process, and it feels like a little olive, it really does. And then projectile, remember the difference in refluxes versus pyloric. reflex dribbles, pyloric, it's across the room like The Exorcist. A multi-select. A child with chronic kidney disease has renal osteodystrophy. What outcomes would you see because of that? What is osteodystrophy? Osteodystrophy has to do with bone pain, bone growth, but it's due to low vitamin D levels because of chronic kidney disease. Vitamin D has a lot to do with bone growth, okay? So you have a problem with bone, vitamin D is a good choice to be taken. And of course, if you don't have good bones, they're not growing, and of course, the pain. Pretty good. You suspect an infant with cryptorchidism. How would you examine the infant? Well, we know it's a boy. It has to be in a warm room. You know, most of us know men, and if they're cold, their sac and everything just shrinks right up. This warm, it will hang. Also, the testicles will. It is the best way to examine and get an accurate examination from them. So in a warm room. A multi-select. What teaching would you give parents on how a hypospadias is corrected? So hypospadias is an opening on the bottom side. We use the foreskin like the plastic repair to cover, you know, the bottom, and then we put a stint in there to keep the inside open and patent. And all we do is change that gauze on the end of the stint. We don't flush it, we don't touch it. It's just there to keep that opening and urine flowing out of it. And it's under general anesthesia. The biggest concern with hypospadias is your Jewish family. They want to do their bris and they can't do it now. So that would be something that may be concerning that you might have to teach a Jewish family. Multi-select. Children with nephrotic syndrome are often given albumin and Lasix for fluid overload. What outcome do you want from that? Remember, nephrotic syndrome is not kidney failure. Not at all. All it is the kidneys don't know how to keep that protein to itself. It just throws it out like crazy. So you're going to see hypoalbuminemia. You're going to see, you know, a proteinuria. And you don't have protein anywhere in the vasculature. All the fluid goes interstitial and you become very swollen. You give albumin. Afterwards, give Lasix, and you're going to see that fluid flow out like you want it to. So increase urine output, edema is going to go away, and you're getting rid of fluid, your blood pressure is going to come down. One of our big things we do with nephrotic syndrome is daily weights, right? A 2-year-old goes to the ER, inconsolable crying and a painful abdomen. What finding shows you this is a medical emergency? Well, abdomen, crying. What do you know about something that could be a medical emergency? I usually say it's that 1 to 3-year-old I see a lot. And this is intussusception. Intussusception is when you have current jelly stool would be the only thing you would see. And these children, until it comes out, it pops out, they're in severe pain. And it is a medical emergency if it stays up there because nothing's flowing. Either it needs to be pushed out with an air enema or gone to surgery to get that piece removed. That's a tricky question, make you think. When assessing a 2-month-old with vomiting, what questions should you ask the parent? How are they vomiting? Dribble or is it coming way out? Good job. You're doing good, Ashley. You notice a child with congestive heart disease, the heart rate's decreasing. What other information is important to report to healthcare provider? So you have heart disease, and your heart rate's going down and down and down. What are you going to do to look at that? So blood pressure on a child, let's say it's a 2-year-old child, that's an infant's heart rate, 68/44. Something's going on. This child needs immediate attention. Very good. A multi-select. When entering the room of a child, the child becomes stiff and the arms and legs start shaking. Priority actions. So notify the response team because you don't know how long it's going to go for. Turn them to the side in case they vomit. You don't want them aspirating. And of course, time and duration, and describe that seizure to, that medical professional. A 3-year-old boy with waddling gait and falling is admitting for testing. What examination should you anticipate? Waddling gait, lordosis, Gower sign, or some other things on this 3-year-old. We just reviewed it last week. And it's called Duchenne muscular dystrophy. Now, when you see waddling gait falling, it's something to do with the muscles not working. There's muscle degeneration that's occurring. So we do the EMG, and remember, the EMG hurts because you're touching those muscles with the nerves and making them flex. So be prepared either before or after that to give that child something because it is uncomfortable. A mother calls the clinic about her child. She's playing in the woods and has a rash and it is spreading. What over-the-counter medicine is good to take? So you do not want to just say, take something. This rash is saying it's spreading. It's getting worse. Is this going to anaphylaxis? This needs to have some medical evaluation, okay? That's why this would be evaluation. Mother calls the clinic. A friend of her child has ticks from playing in the field. What do you tell the mom to do for her child? So what you need to do is just look, see if they're there. Do they have any ticks? And if they do, remove them. And if they don't feel they're getting them all, bring them into the professional look at it. But you just look everywhere, see if they're there, make sure everything comes out. If not, there's medicines that could be taken and you call the healthcare provider for that. An adolescent goes to the school nurse complaining of ringing in her ears. What exam should you do first? So I think the first thing you should do is just look in the ear, see if there's anything there, right? That would be absolutely the first thing. Of course, probably it's loud music. Who knows? There could be something else going on there. And blood pressure is not a bad choice, but first thing, do the obvious, check the ear. Last question. A child's being discharged after 14 days of vancomycin. What teaching should be included to this parent? Vancomycin given for staph, could be given for osteomyelitis, could be given for a positive spinal tap with a bacterial meningitis, not uncommon. You're going to send them home after being on it. Remember, these are SINs. These are the aminoglycosides. We worry about hearing and we worry about urine output. What am I going to do? Well, you're going to monitor those ears and you're going to monitor wet diapers. A trough level at this point, we are beyond the trough. And NSAIDs, we're going to give it for pain or fever, but it doesn't have anything to do with the Venco. So we know who won here. 3 is Meg. 2 is Kirsten. I got rid of everybody. It was boring today. And number 1, Ashley, you did it. Carly and Sean were around too. I know I was going to do that you all had something to do, and I don't blame you. I will be posting this. So, you know, thanks for holding on for me. Appreciate you. I will be posting. I'll be posting that for you. A lot of great questions from all over the place. Okay. And then you have the one that's going to come up Thursday. Similar and not.
Thank you.
Have a good day.
Welcome. You too. Bye-bye.